Hi, my name is Belén Erazo. Today I am told about dental anxiety, smoking, and alcohol using dental patient from Ecuador. Well, definition. Dental anxiety is a complex state that a person presents when considering the idea of undergoing dental treatment and leads to avoiding it, which is why disastrous oral health occurs, which leads to a long and painful treatment that at the same time reinforce or produce more anxiety. Tobacco leads to the development of periodontal disease. One of the mechanisms by which tobacco favors its development seems to be the reduction and alteration of immunological defense against periodontal pathogens. Alcohol affects the pH of the mouth, corrupting to the enamel. pH levels drop below 4.5, favoring cavities and increases dental erosion.
Hi, I'm Dr. Sharma from Provident Dentistry.
Hi, I'm Renee. I'm a hygienist at Provident Dentistry at Canton Park.
Are you afraid of going to the dentist? If so, you're not alone. Nothing to be ashamed of or embarrassed about.
Right. If you have had bad or painful experiences in the past, feel helpless in a dental chair, are embarrassed about your teeth or how long it's been, these can all cause fear of a dental office.
Right. And if you do have dental anxiety, you forget to make your dental appointments. And if there's no appointments, then guess what? You affect your teeth.
Right. In our Novi and our Canton offices, we specialize in nervous patients. We have several ways to help nervous patients through their appointments, and they will leave feeling happy and relieved.
Here are some ways that will make your dental visit pleasant and easy. Firstly, make sure you speak up.
Yes. Again, it is nothing to be ashamed or embarrassed about. It's a very common feeling.
If your dental provider knows that you are fearful, they will spend extra time with you so that way you can communicate and get more relaxed.
Exactly. Nitrous oxide, or laughing gas as many people know it as, can also be another great option. This special gas, it just kind of relaxes you throughout your appointment. It's easily administered. It doesn't require a driver because right after we turn it off, it's expelled through the lungs. It can even be used on children. It's very safe and effective.
In some cases, we also provide oral sedation. In those situations, you will be accompanied with someone so that they can drive you home.
Yes. Another suggestion that works for a lot of our patients and may work for you are headphones. If you can bring headphones to your appointment, you can listen to your favorite songs. It'll drown out the dental sound, so really effective.
Yeah. We also have TVs in each room, so don't hesitate to ask the assistant or someone to turn them on.
Yes. Overall, the best way to overcome fear or anxiety is open communication with us. We will talk you through your appointment, let you know what's going on, as little or as much as you want to know.
We are here for you, so if you have any questions at all, please don't hesitate to ask us before the appointment, during the appointment, or even after.
Yes. And if there is anything that we did not address here, we will be happy to answer. Give us a call, give us a text, or send us an email. Thank you.
Application in odontology. In order to actively contribute to the reduction and control of tobacco or alcohol consumption, it is suggested that health professionals, including dentists, should carry out the following actions guidelines. Consult their patients about the harm caused by tobacco and alcohol use, promoting the development of interdisciplinary programs, in which you will be advised on how to stop smoking or drinking, with appropriate monitoring of each case. Regarding dental anxiety, dentists must explain or imply clearly and consistently what dental procedures will be performed on the patient in order to reassure him. Pros and cons. Pros. It is necessary to evaluate the patient from the moment they enter the dental area to identify if they present any trait of dental fear or anxiety, and to be able to provide them with emotional stability. The role of a good dentist is to try to motivate his patient to reduce and or permanently abandon the consumption of tobacco or alcohol. Cons. Dental anxiety causes a behavior of non-adherence to treatment, mainly observing difficulty in attending consultations, postponing this and resorting to receiving oral care only in the face of painful episodes, which prevents pathological process from being detected in time. Excessive alcohol consumption causes cavities. The typical characteristic of periodontal disease associated with tobacco is the destruction of the supporting tissues of the teeth, with the loss of bone formation of periodontal pockets and occasionally tooth loss.
Hi, I'm Dr. Kumar Vadivel, a licensed periodontist. I want to talk to you about the impact of alcohol on your teeth. If you're watching this video, then I know that you're likely asking the question, is alcohol bad for your teeth? Well, the answer to that depends on two things. How much alcohol you drink, how well you take care of your teeth. If you drink moderately and take good care of your pearly whites, then they are apt to stay in relatively good health. As a whole, alcohol is not good for your teeth. It is acidic, which is destructive to the enamel on your teeth. If you combine your drink with soda, this makes it even more acidic, and the sugar will promote the growth of the bacteria that produces even more acid. Alcohol will also dehydrate your mouth, which reduces the amount of saliva you have. The right amount of saliva is necessary to control the bad bacteria in your mouth, which helps keep your tooth's enamel in good health. The risk of getting periodontal disease is also greatly increased by alcohol because it raises the amount of sugar in your mouth. The other danger that I must mention is the increased risk of oral cancer. Alcohol reduces the protective lining in your mouth and your throat. This means if you smoke, it enables more carcinogens to pass into your body, tripling the possibility of getting a variety of head and neck cancers. You can protect your teeth and keep your smile looking great by minimizing your alcohol intake.
Smoking causes adverse effects on your oral health as well as your general health. Increased plaque, hard tartar deposits and staining can occur, causing an unsightly smile. Furring of the tongue increases the risk of bad breath. The toxins in cigarette smoke cause your heart to become less efficient, reducing blood flow to the tissues that support your teeth. This can cause gums to recede, teeth to become loose, or in extreme cases fall out. Smoking also increases the risk of oral cancer.
Issue obliged in Ecuador. It was considered that traditional dentistry is focused more on curative measures, causing great expense to the country as well as to the patient since the costs of the treatments are high. On the contrary, if the prevention and promotion of oral health is encouraged, as this will stimulate the community to have a positive vision of the dentist and to take care of the oral health because they can adopt healthy behaviors. For this reason, the MACE was implemented in Ecuador, being a set of strategies, policies, tools, and elements to provide comprehensive community dental care to all people, whether healthy or sick, in a community. Thus, health care and social work are also implemented both in the health center and throughout the community. Conclusion. Dental anxiety is a phenomenon that greatly influences the different levels of clinical care, both in its procedure and in adherence to treatment. Health influencing oral health indicators. That is why it's important to address these elements from all these dimensions. Identifying both the reasons with why it occurs, knowing the best way to evaluate it, and establishing the best method of coping with it. Prevention is essential to avoid future illness, which is why it is advisable to eliminate tobacco consumption and moderate intake of alcoholic beverage, brushing teeth after each meal and drink, and visiting the dentist regularly. Thanks.